Vice President of the Federal Republic of Nigeria, Professor Adewole, the chairman for this occasion, Your Royal Highness, Doctor, Public Health Specialist, Adewole, Emir of Shonga. Let me appreciate members of the National Assembly who are hereby present, Chairman, Senate Committee on Health, Dr. Adewole, Chairman, Senate Committee on Customs and Tariff, His Excellency Adewole, members of the House of Representatives, my colleague, GSM on INFEC, Senator Chris Ngige. Let me especially appreciate the President of the Nigerian Medical Association, the Chief Celebrant for today, all past presidents, President of the Pharmaceutical Society of Nigeria, who is my friend and part of the stimulant for this occasion, President of the Association of Medical Lab Sciences, Chief Ben Ayene, President of EGPMPN. I think it is important to borrow the protocol list of the President of the NMA, and I shall be very brief, taking into consideration the time schedule of His Excellency the Vice President. Let me start quickly by appreciating His Excellency for making it to this occasion. His Excellency was in Lagos throughout today, and he actually flew in about an hour ago. And for being here, Your Excellency, we want to deeply appreciate it. One, I think it would be appropriate to congratulate the Nigerian Medical Association for this feat. Holding an event like this is something that we should celebrate. And so, in the usual manner of some of our people in the university, I want to congratulate NMA and also congratulate myself. Mr. President, I want to stretch my hand of fellowship, and I believe all of us in the Federal Ministry of Health and working in conjunction with our colleagues at the state level will work with the NMA. I do not believe we really have a choice than to work with the Nigerian Medical Association. I must identify with your comment about strikes. When I delivered the keynote address at the 2013 NMA Summit, I requested for a moratorium on strikes. We do not need it in the medical profession. Someone said, "Sir, you led the strike in the past." I said, "Yes, I did, but I'm converted." In 1986, I attended a conference in Hungary, and I told the person sitting to me, I said, "Our hospitals are on strike." And he said, "Is your country at war?" Before I could respond, he quickly added that even in wartime situations, hospitals must never be closed. And that is my appeal to the NMA President. With all of us where we are today, we'll work with you such that strikes would not be necessary. And please give us the opportunity, but we also ask for certain things. At a reception organized for me in Ibadan, 7 people spoke and all of them asked for welfare. And I said, out of the 7, not one even promised to deliver good health to our people. I think there must be a balance. As we demand for welfare, let us also offer service. The current workload by World Bank estimate is that the average Nigerian doctor sees 4.2 patients per day. It's one of the lowest anywhere in the world. So we need to work hard. A lot of us senior doctors do nothing, and that's the truth. And we must show leadership. We must train the younger ones so that they will respect us. The current situation we are in today is that the resident doctors do not respect their consultants, and this must change. Let consultants show leadership. The person I'm training has no choice other than to respect me, otherwise I won't train him or her. So let us provide leadership and they will support us. With respect to the sector, a lot of things are not right. We will put them right. It is a commitment, and I want to assure you that under the present administration, a lot of things will be done. Tomorrow, we'll flag up the Save 1 Million Life initiative, where we'll give each state $1.5 million to improve primary care at the state level. At the same occasion, any state that initiates a health insurance or contribution scheme will receive another 100 million naira. So we want to encourage states. What we want them to do is to register pregnant women and children into the scheme. Once you register pregnant women and children into the scheme, you qualify for this allocation. But it will be a matching grant. We want state governments to also put in money. When they put in 100 million, we put in 100. Ogun State has started by putting 100, we will put 100. And this is to encourage them to do well. By Monday, we will flag off what we call the Rapid Result Initiative, where we will do 10,000 surgeries in 3 months. And we are going to use 46 hospitals across the country, mostly for poor people, those who could not afford to pay. People will ask, how are we going to identify the poor? We will try. I think what is important is not to exclude a poor person. 1 or 2 rich people might really scale through, that will be okay. But we will not want a poor person to be excluded. Apart from 10,000 surgeries that we do, we will also screen about 20,000 women for cervical and breast cancers. We will screen 500,000 Nigerians for diabetes and for hypertension. So these are things we want to do rapidly as part of our commitment to improving the health of our people. Please work with us, we'll work with you. We are committed and we will make you proud in this sector. And as a way of building trust and also ensuring reduction of interprofessional rivalry, we intend to hold a meeting with the leadership of all the associations on Tuesday at 10 a.m. at the conference hall of the Ministry of Health. We want President and Secretary, NMA, Medical Lab Sciences, Pharmaceutical Society, including USU, let us sit down and talk. When we talk, we will be able to really address issues. We will not want to address challenges of doctors today only to face USU tomorrow, and then pharmacies the day after. Let us sit down as a group and work together. Once again, congratulations, and I will say long live NMA, long live the health sector, long live the Federal Republic of Nigeria.